morning, Commissioners.
Morning.
Or afternoon. Good afternoon, Commissioners. I think it's perfect that we go immediately following David Royer and the ADAM Board, and because many of the issues that David is addressing, and to your point, Commissioner, how many of these intersect with our folks in law enforcement and incarceration, our office has the unique position of being sort of the bridge agency, often between all of those partners. And so many of the questions that you may have had regarding how we're addressing opiates inside the correctional facility and so forth, I hope to touch on today in my presentation. So, Commissioners, my name is Michael Daniels. I am your Justice Policy Coordinator, and I'm here to present to you the 2019 proposed budget for the Office of Justice Policy and Programs, where we strive every day to provide smart justice for every resident. What have I done? There we go. Commissioners, as you're aware, smart justice is a term that was originally coined by the National Association of Counties and the ACLU, and it refers to that sort of sweet spot, that intersectional sweet spot between public safety, economic justice, or economic development and social justice. It allows us to continue to arrest and incarcerate folks who are actually dangerous and who are a threat to the community, while allowing us to divert people who have made mistakes or who find themselves caught up in cycles of poverty where crime to them is their only option for survival, and to deflect folks who are suffering from mental illness and substance use disorder. In short, as we've tried to say for the last couple of years, we want to have a correctional system and a justice system where we incarcerate people that we're afraid of, not people that we're mad at or disappointed in, or people who are just sick and the jail becomes the default place that we house them. Commissioners, our 2019 recommended budget is just at $3.48 million. As you know, we used to be a combined department, Homeland Security and Justice Programs. We still are on the books, running as two separate offices, the Office of Homeland Security and Regional Communications, run by Director Crandall, and the Office of Justice Policy and Programs, which I have the honor of leading. If you go back to our 2017 actual budget and divide out the pieces that were part of just the Office of Justice Policy and Programs functions, that budget was $1.9 million with $1.48 million in grant revenue. For 2019, our recommended budget shows $2.8 million in grant revenue. That's an increase of 89% in total grants received over the course of one budget cycle. Remember that our grant applications usually open in March or April. Our applications are due in June, and we receive our awards in September to start fiscal year October 1st. So we're extremely proud of the work that we've done here. My team is beyond compare in their ability to do the research to come up with innovative program, and then to write in a way that the grants are actually received and the money's distributed to help the residents of Franklin County. Like most presentations, we're going to try to hit a few highlights of what we've accomplished in 2018 and then talk a bit more about what we'll do in 2019 with this expanded funding and additional grant revenue that we've received. In 2018, Commissioners, I think we can say fully that we have integrated the stepping up philosophy into the DNA of the way we do business, not just as an office, but as a county. The Stepping Up Initiative is a national initiative of the National Association of Counties, Council of State Governments Justice Center, and the American Psychiatric Association Foundation, whose sole focus is to reduce the number of folks with mental illness who find themselves languishing incarcerated in our jails. I think over the last 2.5, 3 years, we've truly made this part of our DNA. We've been leaders across the board with our peers on this issue. And in fact, we were one of the jurisdictions chosen to pilot a self-evaluation tool, which a screenshot of which is unreadable on the slide in front of you. Yeah. But the bottom line is, if you put it in there and make it small enough, then people just believe what you tell them. Using this self-evaluation tool, Commissioners, we are scoring about 81%, having completed about 81% of the tasks toward full implementation of a true Stepping Up program. I will say that makes us the number one county in the United States in terms of what percentage implementation we have done. I will also say that the Pareto principle absolutely applies here. We're 80% of the way through implementation, and we've accomplished about 20% of our goals. The last 20% of the implementation is where the real heavy lifting is going to be, and that will help us to achieve the remaining 80% of our goals. But we're very pleased about how far we are along the way, and the way that this has now become an ingrained part of every discussion. We don't have to sell people anymore on this as a concept. People have bought into this, and it's just the way we do business in Franklin County. In 2018, Kisten Palmore, our reentry director, reentry coordinator. First of all, hats off to her. She was the first Franklin County employee to be enrolled in the NACO Professional Development Academy that was released last year. Thank you, Mr. Administrator, for allowing that to be the case. And Kisten kicked off two very, I think, innovative programs last year. The first one is that she partners with both agencies here within the Board of Commissioners, as well as a variety of community partners, and once a month does a video in-reach to 22 prisons across the state, where she speaks with inmates who report that they are going to be returning to Franklin County, to provide them with listings of resources, answer questions in real time, give them links to information, and more importantly, put a face to what our department is, so that when they come back, they feel comfortable and have someone to talk to. We're reaching hundreds of inmates a month through this program. Once people come back, First Step Franklin County is a program that Kisten put together, which started out small and has grown mightily. She now monthly is able to wrangle and coordinate 27 both departments and community partner agencies into one room, where folks who are just as involved in Franklin County can go on the first Friday of each month. And what's unique about this is that it's not a standard resource fair where you go in and get a brochure and a phone number and you're told, okay, go home and call this number and make an appointment. But rather, when someone walks in the door, they're given a personal concierge who walks them from station to station, and the agencies who are there are connected to the internet in real time and have the ability to solve people's problems on site. So you can walk in to this with a suspended driving license and walk out with a valid one. This is a program that we said this is how we serve people, 1.3 million people, one at a time. And that's what we're doing in this. And hats off to Kisten for being able to pull off what's nothing short of a Herculean effort. Using a comprehensive opioid abuse prevention grant that we secured in 2017, we are proud sponsors and funders of the Whitehall Help for Overdoses program, which is currently being undertaken in the city of Whitehall. Our Caitlin Looney is our project manager on this. She's been on the grant from the very beginning and has become the architect both of its design and its success. Two of the major components to this are a mayor's court for folks whose crimes involve some sort of opiate, and the Whitehall Safe Stations program, which is a tremendously innovative program where anyone can walk into the fire station at Whitehall any time of the day or night and say, I'm addicted to opiates and I want help. They will be immediately assessed, immediately taken from the fire station to treatment, where they are guaranteed entry into treatment at Maryhaven. We've had folks who have walked in who literally have pulled bags out of their pockets, set them down with a cooker and bags of heroin and syringes, and said, I'm ready to quit, take this poison away from me, and I need help. At this point, we've transported 225 people directly to care. Pathways for Women's Healthy Living speaks for itself in Franklin County. It's the program we put together in 2015 using a Justice and Mental Health Collaboration grant. We're proud that we've just graduated, after 3 years, our 11th cohort. We've served more than 200 women in this program, which provides cognitive behavioral therapy coupled with pro-social activities such as peace, love, art, yoga, and mindfulness. Targeted to women who are frequent recidivists. In fact, to get into the program, you have to have been arrested multiple times in the last few years, who also have mental health and substance use disorder conditions. Commissioners, I think the numbers then begin to speak for themselves. And the first 3 cohorts of folks who graduated in 2015 who entered into the full program, and while that's a small number, that's 26 women who did this in 2015, in the 3 years prior to the program had racked up 2,425 nights at the jail. In the 2 years post-release, that number's down to 516. Total number of bookings gone from 65 to 13, and only 5 convictions have happened 2 years post-program. We could not be more proud of this. I could not be more proud of Patrice Palmer and the way she and her team implement this program with help from Bailey Stobart, Caitlin Condon, Looney, and Courtney Benner. We, in slight preview, we wrote for, Melissa Pearson wrote for, and received not one, but two major grants for 2018. And using some of the money from the Substance Abuse and Mental Health Services Administration grant, we have secured solid funding for this program for its expansion and its extension through the end of 2021. Using funding from Franklin County Public Health and some leverage that we have with other partners, we are an authorized distributor of Narcan. Commissioners, if you aren't carrying this in your briefcases, we'll be happy to train you so you can. But we've distributed 107 sets of Narcan kits to folks who are either at risk or live with someone who is at risk of opiate overdose. We'll be continuing this program next year with additional public health funding. We're empowering people to take control of their lives, control of the health of their families, and to save lives, and we know that this works. Similarly, through the courage of this commission, we partnered with Columbus Public Health and the mayor's office to be funders of and strong supporters of a Safe Point Needle Exchange program, working with Equitas Health, where folks can come in. People who are in active addiction can come in. They can actually exchange their dirty needles for clean ones, thus cutting down the transmission of bloodborne diseases such as hepatitis C and HIV. And when they come in, we always make sure that they get a health assessment, we always offer them education, and we always offer them access to treatment. We fully intend to continue funding this program in the future, but stepping down our funding while helping public health and Equitas to find additional sources of revenue. For 2019, we'll continue our we'll continue our obligations to administer federal grant oversight, including the Justice Assistance Grant supporting law enforcement, the Violence Against Women Act funding, which supports victims of domestic violence and stalking, and the Title II Youth Delinquency Prevention money, which is targeted to keep particularly minority youth either out of the criminal justice system or keep them from returning to the criminal justice system. Our grants administrator on all of these things, again, is Melissa Pearson. You'll hear her name like a million times because she's actually really the person who does all the work in my office. And our fiscal officer, Hope Foster, and then also our data analyst, Courtney Benner, are critical to keeping these projects along and moving. Commissioners, under the leadership of Kiston Palmore and Paige Allen from the Franklin County Municipal Court, we wrote for and received a MacArthur Safety and Justice Challenge grant for $50,000, which we will be implementing in 2019, specifically to study the impacts of racial disparity and lack of participation in certain diversion programs, specifically the specialized dockets in the municipal court by people of color. I don't know where I read it. I think it was some wise man who was quoted in the Dispatch this morning as saying this is going to be a tough conversation. It's going to require a moment of history. Commissioner Bush, you were exactly right when you said that about the poverty initiative. This is dead in there. We have to become comfortable talking about this uncomfortable topic. If we don't address racial disparity throughout the entire criminal justice system, we have no hope of helping to solve poverty in communities of color. We're going head into this, and it's because of the courage of this board that we're able to do so. So thank you for that. Using targeted community alternatives to prison funding.
Use the other one.
Okay. Using targeted community alternatives to prison funding from the state of Ohio. We are implementing a frequent user system engagement program where we will be taking 45 or 50, no fewer than 45 of our most frequent jail recidivists and connecting them to permanent supportive housing with wraparound services. These are folks who come to jail on average at least 6 or more times and spend at least 150 or more days in jail over a 3-year period. We'll be engaging with both men and women with the primary goal of keeping people from returning to jail, keeping people from consuming jail bed nights. Additional resources to provide things like sobriety, work readiness, et cetera, will also be provided. I personally will be project managing the FUSE program. A great amount of the dollars that were received in the 2 grants that Melissa wrote for and received, both the Substance and Mental Health Services Administration grant as well as a second Comprehensive Opioid Addiction Prevention grant, will be used to greatly expand medically assisted treatment inside the jail. We are currently able to offer Vivitrol to a few folks inside the jail. That will tremendously increase. We're hiring a full-time MAT coordinator who will be working inside the jail with the sheriff but reporting through our office. And we will be able to take referrals by inmate request and also by court or attorney referral, do all of the preliminary health assessment, blood workup, et cetera, and give the first shot pre-release using the grant funds. And the key then is connecting people, and that's why the MAT coordinator's position is so important, is connecting people after that first shot to who their healthcare provider is going to be on the outside and following up to make sure that they make that first outside appointment and get that second shot. As the county administrator is well aware and reminds us all the time, people who are not using medically assisted treatment, who are trying to get off of opiates, are successful approximately 3% of the time. The other 97 folks who are successful are using some sort of medically assisted treatment. So we consider this to be a critical component of care. We're also happy to have helped convene some conversations and support some concepts. Even if it's not something that we're running from within our department, if we can help to set the conversation and set the table, we're happy to do so. Some examples of that are a veterans housing unit, which is currently being implemented inside of the jail facility, which is something that was very important to Sheriff Baldwin and grabbed onto by Colonel Bramwish from the Veterans Services Commission. I know that the Colonel will be discussing this in his budget testimony, which immediately follows mine.
The sheriff talked about it last week as well.
Yeah, I mean, it's just critically important. Last Friday saw the kickoff of a very culturally competent and very structured LGBTQ inmate program. We started that out with a Peace Love Art project run by our own Dr. Patrice Palmer in conjunction with Deputy Tressel and Butler. My hat's off to Chief Penny Perry, who has been an unflagging supporter of this concept. We presented on this last year when NACA was in Columbus. We kicked off this idea at a roundtable conversation, and we finally brought it to fruition, and it launched last Friday. So we're tickled that we've been able to actually do this. And using the SAMHSA monies that are in the new grant for next year, we will be funding some sort of iteration of Pathways for Men. We're still working out exactly what that programming looks like and what the eligibility might be. With the sheriff's office, again, our partners there in the jail have been wonderful and wanting to do this. We will probably outsource the actual program delivery under our supervision and curriculum, and then we'll hire male peer support specialists to work within our office for post-release. Commissioners, we like to think that here we stay on the front edge, state and national leadership, with stepping up with the National Association of Counties Justice and Public Safety Committee and LGBT Committee, the Ohio Justice Alliance for Community Corrections, the County Commissioners Association of Ohio. We're not afraid to be on the front edge, and in fact, as the caption says, if you're not the lead dog, the scenery doesn't change very much. So we kind of like being the lead dog. What's the 2020 goal? As it has always been, 30% reduction in the total number of people who are incarcerated, a 50% reduction in the number of folks who have mental health and substance use disorder in the jail, and a 50% reduction in the disparities in the way they are treated, average length of stay, charge level, et cetera, between folks who do and do not have a mental health condition by 2020. Those goals have not changed, and we don't expect them to. I have a world-class team that I work with, both the folks who are in my office as well as my partners on the outside, but Melissa, Kiston, Patrice, Caitlin, Hope, Courtney, Bailey, the peer supporters that we work with. I literally, when I travel around the country and I talk to my peers, they all say, how do you do what you do? How do we get the people that you've got? How do we get the partnerships that you have? How do you get your job and family services and office on aging and sheriff's office and Veterans Commission, and Adam Board, and. How do you get all those folks to work together? We just do it right in Franklin County. And we're just so incredibly, we should reflect every once in a while on just how lucky and blessed we are that we have a system that everybody pulls together for the common good and that it works. So we talked a lot about numbers, talked a lot about programs, but this is why we do what we do. I think commissioners may have all had the pleasure of meeting Miss Stella. I'm not sure, Commissioner Boyce, if you have yet, but Miss Stella learned to steal from when she was 5 years old from her mother. That was her learning experience into that. Over the next 4 decades, Stella found herself in prison 4 times. She found herself arrested in the jail dozens of times. She found herself being stopped on the street hundreds of times. And on her last round to the jail, she said, I want to try something different. She found some weird new program called Pathways. She entered into it. This is a picture of Stella signing the first lease on the first apartment she's ever had in her own name in her life. This is why we do the work that we do, and this is why the folks that we work with are so critical. In closing, commissioners, I just want to thank you for your continued vision and support that have allowed us to get where we are, and your commitment and courage to allow us to go where we want to go. For the leadership of county administration and the deputy administrators, thank you for all of your support and input. Zach and Lagrita in the Office of Management and Budget, who hold us accountable. And commissioners on a personal level, having been through now the first full year of grant cycle and so forth, leading the department downstairs, thank you for your confidence, and look forward to continuing to do good things for the residents of the county. I'd be happy to take any questions.
Comments or questions?
Thank you.
I don't think so. Thank you. Nice job. Well done.
Great stuff. Keep it up.
Thank you, sir.
Next up, Veteran Service Commission. Take a couple minutes for transition.